Yeah, good morning, everybody. Thank you, Arup, for the kind invitation. And can you please leave the mouse? There's an advantage of speaking after Doug Koch, is that you really don't have to speak, because he's covered most of what I had to speak. The biggest disadvantage is you'll find how inadequate my talk is. So let's get on with our business. I'll try to stick to basics. I'm a little intimidated by these formulae. So like Doug Koch said, that it is essential not only to implant an IOL, but to be accurate too. And no, I mean, we have to give credit where it's due for the implantation of the IOL, but then there were errors with Sir Harold Ridley and even Bing Cost. So, and it is also true that we need to attend meetings like this and get updated so that we use the most current practices in our day-to-day work. Now, the biggest difference between ultrasonic biometry and optical biometry is in terms of accuracy, where there is a lesser resolution in ultrasonic, and in the optical it's pretty close to, the measurements are 0.012 millimeters. Now, why is this a problem for us? Because if you look at the combinations that are available, there are 9 types of eyes, if so to say, if you see the anterior segment size and the axial length. So, and unfortunately, less than 75% fall within the normal of the axial length and the normal, anterior segment normals. So, this is something we've been through repeatedly through the morning, so I'll skip this part. Now, this is where the optimization worked, where in long eyes, the formulae at that point in time tended to select IOLs with insufficient power, leaving postoperative hyperopia. So, this optimization by Wang Koch significantly reduced the percentage of long eyes with the hyperopic outcome. So, these are now things of the past. Now, we have what is called static formulae and dynamic formulae. Static formulae are one which you actually don't change over a period of time, and if you actually do a fudge factor for the A constant, the entire formula shifts up and down, which really has no value. The AI-based formulae or the more current formulae adapt dynamically with time, and as you will see, the orange line is where it starts, and that's off by about a larger amount of variation in diopters, and as data gets added on, it comes closer to the blue line where you are within, as close to 0 as possible. This again is something which we've been through many times in the morning. So, this accuracy of intraocular lens calculation formula, by and large, Barrett Universal 2 has served the purpose for a good purpose for a long period of time. Now, if you look at the prediction error in diopters versus intraocular lens power, again you will see that the Barrett formula does best, and then it's followed by Huygens and the other formulae. And if you look at the prediction error in diopters versus the axial length, again the Barrett did better than others. Now we come to the crux of the problem, short eyes, as Doug has told us that. Now, there is something which we have to understand very clearly. A small axial length combined with a high power IL can cause a large refractive surface, even with a minimal shift in ELP. Now, ELP has been the biggest bugbear in the entire IL calculation process, and if there is a small shift over here, this is a huge difference. And there is something which Doug also touched upon, but I don't know if most of you understood the significance of that particular slide. Tolerance of IOLs with a power of higher than 30 diopters is plus minus 1 diopter as per ISO standards, which means the manufacturer can get away by making a lens of 29 diopters or 31 diopters for what you choose as 30. So, you'll be off by 1 diopter clearly, and the manufacturer cannot be blamed for that. So, that is something which you have to keep in mind. Now, in short eyes, this is a meta-analysis. Again, this showed Barrett Universal 2. This is slightly older data, but then this is a good meta-analysis. Barrett Universal 2 served the purpose better than others among the formulae. And then the newer generation formulae, the Pearl DGS and the Oculix work better. Now, in long eye, there's a large vitreous component, and that contributes to errors over here. So, And if you look at, and there is another problem. See, in the long eyes, we have poor fixation, and we have a staphyloma, and you don't know where the macula is on the staphyloma, which part of the slope it is on, and that's where our inaccuracies come from. And if you look at figures, if the axial length is greater than 26 millimeter, a 1 millimeter increase in axial length led to an increase in absolute error by about just 0.1 diopters. Now, when the axial length increased to 33 millimeters or more, the error was about 1.1 diopters. So the axial length makes a lot of difference. Prevalence of posterior staphyloma by axial length, if it's 26.5 millimeters, it's just 1.4%. And when the axial length goes to 33.5 millimeters, it's almost 70%, more than 70% that have a staphyloma. So that's where the errors are going to happen. So in long eyes, what we have is the optical biometry assigns a single global index of refraction, and that's where the problem lies. So because of the greater amount of vitreous over here, so longer the eye, the greater the error. So, and also we need to remember that in high myopia, it need not necessarily be a long eye. It could be what we call index myopia, or like in ROP, you have high myopia which is primarily lenticular. In sticklers, you have high myopia which is axial. In Marfan's, you have a combination of both. In long eyes, again, in this meta-analysis, they found the Barrett Universal 2 was much better than others. And newer generation formulae again showed more accurate results. Now, in summary, the accuracy of the refractive power of the intraocular lens depends on the exactness of the IOL power calculation formulae. Now, accuracy depends on the axial length and corneal curvature primarily, but then ELP is a huge contributing factor, which is still an enigma. There is no consensus as yet in literature, and we have surprises every day with every formula. So a review of current literature, which is it's an evolving process, it's a dynamic process, and we need to evolve along with the formulae. So Barrett's Universal 2 or the True K are among the Virgin's formula which are working well now, and the KN are the Pearl DGS, and probably some Hill RBF are working good among the AI supported formula. Thank you very much for your kind attention.
Thanks a lot,